The biggest thing we want to look at is when we look at the analogy between a funeral and what a child who's entering an adoptive home. The similarities are that at a funeral we've experienced a death, and so we have a wide range of feelings. We could have feelings of sadness, of anger, of disbelief, of anxiety, of just blankness. Sometimes you see at a funeral people just are in a zombie state, or people are really angry, and yet at a funeral we normalize that. We expect that to happen. But we also plan for it. We plan for support. We plan for people to be there to support the person. We bring meals to families who have suffered a loss because they don't want to have to go to the supermarket. And yet with our children, when they're moved into an adoptive home, if we don't honor the existing losses they have, they can manifest those same emotions and then potentially cause a lot of problems. It's the same thing with thoughts. Thoughts at a funeral, you're unsure why. You may feel guilty about it. You may feel anger and those raging thoughts. And you may think about, why do I want to live at all? Again, the same things happen with our youth, who have had profound loss and trauma. And those thoughts can play through right into the adoptive home and be very difficult to deal with. So you plan for that. Again, you think you're going to have a wide range of thoughts, in your, going through your head because of this. And whatever you're thinking about, let us know and we can help you. The third thing you want to look at categorically is behaviors. At a funeral, there's a lot of times people just up and leave. And yet we don't call that AWOLing. We don't call that running away. We call someone who just needs to take a break from it. We don't lock the doors and say, just because you want to leave, you can't leave. Sometimes people get up and get angry, and they may yell. Again, we don't tell them to shut up. We don't tell them to be quiet. We honor the anger and we honor those struggles. When they move into an adoptive home, our children and youth experience some of those same behaviors. And yet if we don't think about it from the mindset of loss and normalizing it, then we can pathologize it and suddenly the kid becomes the problem. So if you look at all those emotions and thoughts and behaviors, there's no way that if they're dangerous and violent, I'm not condoning that. But I think we also have to avoid condemning the child because they're having normal experiences and reactions to a very unnatural and unnormal experience through their trauma and their loss. And if the adoptive family, with support of the recruiters and all the other support, mental health and the other professionals, they can help normalize that experience for the child. Normalize it for the adoptive family too, because sometimes our kids can look very bizarre and what's going on here? But if you bring the context of loss and into it, then you can help normalize it and embrace it, and then the child can heal.